I'm Todd Neal with MedPage Today. The American Society of Echocardiography, in collaboration with the American College of Cardiology, the American Heart Association, and several other societies, recently updated the appropriateness use criteria for echocardiography. I spoke with Dr. Smadar Court of Stony Brook University Medical Center about the importance of such guidance.
The number of imaging studies have increased substantially over the last few years. One of the questions asked is the number increased because we can now do a better job evaluating patients using these imaging technologies, getting more information, and as a result better treat our patients, or we just perform more because we can perform more and do more studies. So one of the ways to try to answer that question was to actually develop these appropriateness use criteria documents. And by looking at how physicians actually perform based on those criteria, actually see whether studies are performed for an appropriate reason or not.
The first appropriateness use criteria addressing rest and stress echocardiograms were published in 2007 and 2008, respectively. A document revising all of the criteria was released earlier this year. Court and her colleagues wanted to see how the older and newer versions of the criteria performed in terms of classifying tests into appropriate, uncertain, or inappropriate indications.
So we looked at studies that were performed in our institution at Stony Brook University Medical Center over a 2-week period, and we applied both documents to each one of those studies. What we found was that by applying the new document, the rate of uncertain indications was actually lower, while the rate of appropriate studies as well as the rate of inappropriate studies were increased. So we conclude that the newer document is actually easier to apply in a clinical setting because it can better differentiate between appropriate and inappropriate studies. It also shows that unless the medical community is familiar with the new document, if they continue to follow the older document, the rate of inappropriate studies may slightly increase. So the recommendation is really for the medical community to be familiar with the new document and apply to clinical practice.
For MedPage Today, I'm Todd Neal.